At this time, I'm pleased to introduce our first speaker, Senator William H. Frist, a nationally acclaimed heart and lung transplant surgeon, former U.S. Senate Majority Leader, and Chairman of the Executive Council of Cressy and Company. He is engaged in business as well as the medical, humanitarian, and philanthropic communities, and he's also a member of NIHCM's advisory board. And we're so pleased he's joining us today to share his perspective on telemedicine.
Catherine, thank you very much. Thank you very much, and it's great to be with everybody for what's really an exciting hour and a half, looking over the speakers that are to follow, and then with questions and answers at the end. I'm going to do a little scene setting and then use a few examples, but basically spend my time looking at the challenges that we have in the current landscape, and secondly, looking at telemedicine as a solution. Thirdly, the case study of Teladoc. Throughout the other presentations, there'll be lots of other examples, so I'll use Teladoc just very briefly as a scene setter for what is to follow. The current medical landscape, the problems are really four as I see them. Number one is the lack of access. 80% of adults discharged from an emergency department in one study were due to a lack of access to other providers. So we naturally ask the question of what would happen if there was some other option. We all know from our policy studies these huge pockets of underserved. For example, there are 200 counties in Texas that are designated medically underserved. 16 counties have just primary care. 27 counties in Texas, none at all. Yet in truth, if you step back, given technology today, everybody in each of those 27 counties where there are no primary care doctors, or 16 or the 200 underserved, are within 10 minutes of talking to a fully boarded, fully trained, fully licensed physician in their state within 10 minutes. The second big issue is that of the physician shortage itself. We all know it. The 52,000 on the slide there on the right lower corner is an approximation, but if you look on the left, it signifies the demand because of population growth, the aging of the population, which is a wonderful benefit to where we are today in society, and the increased access with the Affordable Care Act and the aggregate around the country. That's a reflection of the increased demand, and whether it's 40 or 50 or 52,000 primary care physicians, we know, and we're using physicians as the measure here, but we know there is a provider care shortage. That's problem number two. Problem number three, the cost of care. We don't really anything else other than the cost. Spending continues to increase. The people around the country are saying spending is flattening out, but this slide, which was produced by the Kaiser Family Foundation, of which I'm on the board, but Drew Altman released it yesterday, is a fascinating slide. If you look at the right, this is year-over-year growth in health services spending by quarter, and you can see since the first quarter of 2004, it's gone from 2% growth to 3% growth the next quarter to 5% growth the next quarter to 5% to 7%. The whole point is that cost and spending pressure is increasing now. It's on the rise in the last 5 quarters, and that is the reality where we are today. The fourth big issue, again, it's an obvious one, is that the out-of-pocket cost is so totally different than 5 years ago or even ago. The out-of-pocket costs mean that the burden of that first dollar coverage, no matter how good the insurance is in terms of the number of insured, that burden of the cost of that deductible, which is now typically $3,000, $4,000, and $5,000, is resting with the consumer. And as the consumer or the individual or the family with these deductibles continues to rise, care and access to care is going to fall, as you can see from that first box, unless it is lowered by some alternative out there. And of course, the alternative we're speaking to today is telemedicine. A solution is telemedicine. What is it? We'll all have our different definitions. We know what it is that it revolutionizes how consumers access, use, enter execute within the healthcare system by delivering access remotely, not right in the presence of bricks and mortar necessarily, to care that is more affordable, that's of equal quality, of high quality, and then I add there when, where, and how the patient chooses, because the patient really has other barriers, whether it's cost or 2-hour drive, transportation, or waiting rooms, or parking lots. All of that disappears. What is telemedicine? It is not the practice of medicine, and as a doctor who's been in the field and practiced medicine extensively for years and years and years, it's probably the hardest concept I have in communicating to other physicians. Telemedicine is a tool. It's not the practice of medicine. It's a tool that allows doctors, physicians, others practice medicine for the care of the individual patients who are located maybe a block away, or 5 blocks away, or 10 miles away, or 100 miles away, or 1,000 miles away, or around the world. It can be done when we say telehealth. People think just video, and as a doctor, I used to think, well, video is not going to quite do it. You got to touch the patient, you got to examine the patient with your hands, and then video sort of says, is it going to really work? And the answer is yes, it works. And then now what we realize, for most conditions today, you don't even absolutely have to have the video. Whether it can be telephonic, it can be other types of communication. It's up to the standard of the individual doctor to determine whether the standard of care can be met. I think it's very important for telemedicine, to the technology end of it, allow the physicians to be making the ultimate standard of care decisions, and that's exactly what it does, because the technology is just a tool. The last point is that there are now, unlike 5 years ago or 10 years ago, many studies with robust quality measures showing that equal, and in some cases better, care in the medical literature are being through remote access. Telemedicine, where is it going to go? Again, these slides are going to all be available for people, so I don't need to go through and read each one, but just looking at the points, it's huge. It's going to grow. It is growing. There are certain barriers out there, but it just makes too much common sense. 62 million people without primary care today. We have, yes, fewer uninsured, which is a very positive thing, but as I implied, with higher deductibles, not everybody with insurance is going to be accessing physicians, especially on the preventive side, or getting disease early, if they have to drive 3 or 4 hours, wait in an emergency room for an hour, or exaggerate, but that's what happens in many counties, or have to pay an average $14 emergency room bill, when they would have an alternative. 33% of all office visits, that third bullet there, are potentially addressable with telehealth today. Again, 1 out of 3 office visits are relying on telemedicine extensively. 71% of employers with more than 1,000 employees will offer telehealth in the next 18 months. And then the last point, the telehealth market's seeing record growth. Most people will say that the overall market's going to grow from somewhere between 20 and 30 and as high as 35% a year. People are interested. Attitudes are changing. In the U.S., they've gone this huge shift in recent years. A recent survey by WHO shows that 76% of patients prioritize access to health care over the need for human-to-human live in-person interactions. 70%, almost 3/4 of patients, are comfortable communicating with their healthcare providers via text, electronically, email, videos, versus seeing them in person. There are barriers limiting the medicine, huge consumer demand. The medical profession increasingly comfortable with it, although most of us weren't trained with it, and therefore there is a cultural shift for people like myself, physicians and nurses and social workers. It's like everything else, technology takes change and adoption with culture. The two most limiting sort of restrictions to its spread are the ones centering around and visit at the top of that slide, and then the licensure, which is by state below. The in-person visit, which has gotten a lot of attention recently, requiring an in-person exam and visit before any remote follow-up is allowed, that's a huge barrier, because what you're doing is basically saying if you live 200 miles away that you need to come see a doctor face-to-face, almost in essence like getting a prescription, and then in order to be able to middle of the night at 2 o'clock in the morning when your child has a bad cough and you don't know what to do. It's just so impractical. So in the licensure, increasingly getting and putting together regional cooperatives in terms of licensure acceptance, and I think there'll be more and more of that as we move forward. Briefly, and this is the third section, the case study of Teladoc, and let me say right up front, just so there's no, so it's clear, I am Teladoc and chose to be on that board because it is one of the larger telemedicine firms that are out there. I do want to put this that since I am on the board, that anything that I say here is solely for illustrative purposes, educational purposes, and constitutes an offer to sell or soliciting an offer to buy securities in any jurisdiction. The process is straightforward. And again, you'll hear several other examples today. They're all the same, in that you can go computer or phone, complete very quickly. It takes maybe 2 to 3 minutes, depending on how extensive that is. You request a consult. In a short period of time, you are, say, within 10 minutes. It might be 6 minutes, it might be 15 minutes, but it's very quickly with a physician that is licensed in the state, licensed nationally in the state that you're talking to, who is, as I said, board qualified, or board has their boards in the specialty. The issue is talked about, resolved. That can take an hour. It can take 10 minutes. It can take 15 minutes. Everybody knows when it could take just a few minutes, or it could take a much longer time, but typically it's in a period of minutes, say 15 minutes. Continuity of care is established by the physician in consultation with the patient, and then settling up to make sure that there is follow-up and whatever financial arrangement has been made or agreed to in that particular case. So it's very, very straightforward. As technology improves, it becomes easier and easier. Can be done mobilely, can be done on the cell phone, can be done on tablets, and can be done by computer and by telephone, just with 800 number. This is an interesting slide just as we talk over the course of the hour. The most uses on the left, the top 10 diagnoses, and this is from about 1 million patients or 800,000 patients. If you just look at what the chief complaint or their primary reason for the call is, it is things like sinus problems, urinary tract infection, pink eye, then upper respiratory illnesses like bronchitis or the flu or cough, and nasal congestion, and then ear infection. But if you look, overwhelmingly it sits in the sinus problems, urinary infection, pink eye, and bronchitis. I mention those because once you hit an emergency room with a $400 admit fee, a consultation, usually a blood screen just when you walk in the door, before you even see the physician, you know these are the sort of problems that can be diagnosed much more easily than in the standard steps that you take when you hit an emergency room. Looking over to the right side, again, I don't need to, it's no help to go through them directly, but let me just pick a couple. You can either do electronic or by phone. Yes, drugs are prescribed. If you go on down to the second to the last bullet, you see that Teladoc does no prescribing of narcotics, DEA-controlled substances, medications for psychiatric illness, or lifestyle drugs. Company to companies vary, but those are areas that Teladoc does not prescribe in. And the last bullet, generic drugs are frontline drugs, and the ones that are recommended unless a generic drug simply is not is not available. The second bullet I have describing lower than same diagnoses when comparing best provider practices. I'll qualify that a little bit. I'll say comparable. In the antibiotic field, as all of us know, everybody needs to use less antibiotics. The recent RAND study out shows that Teladoc uses antibiotics at about the same level for a group of the illnesses as in best of practice in a community. The things that is pretty neat about the telemedicine, when you're seeing hundreds of thousands of consultations, you really can do best practice. You can monitor best practice, evidence-based guidelines. You know they're applied consistently, and then you can do ongoing quality review of each and every interaction because it's done electronically. The RAND study from 2015, just look at the last two, 21% of visits were made by patients who had not accessed health care in the previous year. It kind of says, why do you have to go to a doctor in their office in a building to get permission to use telemedicine? It's one that kind of just doesn't make sense. And then the last bullet, 25% of patients who did not have a telehealth service benefit actually went to the emergency room as their next best alternative for care. In other words, you haven't signed up, you didn't access telehealth, you couldn't access them, where are you going to end up? You're going to go to the emergency room, and the average charge for these emergency rooms is about $1,400 a visit versus what might be a $40 phone call or a $30 or a $50 or $60 phone call or video interaction. Huge cost savings as well. To just grow, this is just an example of Teladoc growth, and I use it as an example just as a case study, but there's sort of 5 big telehealth, and a lot of people, as we'll hear from the other speakers, are using telemedicine, telehealth, telemonitoring in other ways. But if you just look at the top box there, in 2013, 127,000 consultations, and then in 2014, 298 consultations. You see the huge number of people who are taking advantage of this new technology. And then in the left two vertical boxes, you see that 8.1 million people are on the Teladoc platform today and could tonight, if there's an illness or something not going quite right, could access a doctor within 8, 9, 10, 15 minutes if something goes wrong and they need that sort of care. So lastly, why the growth? Consumers are demanding more convenient care. Employers and plans are flocking towards it because they want to be able to provide the best care at the lowest cost for their employees. Telehealth offerings are more sophisticated. The user satisfaction, net promoter score type measurements is sky high. Lastly, consumers want it. They're speaking loudly. They desire it. They see the benefit. They want to access primary care on their terms. Telemedicine offers this opportunity with maximal convenience to the consumer, whether it's drive time, financial, green barriers. They know that equal or better quality cost. And there's true cost savings to employers. And in 2015, 50% of large employers will telemedicine in their health plans. And my sort of bottom line that I sort of summarize it all with, telemedicine is indeed transforming health delivery. Thank you very much.